By the way, this one, it has had its mouth cut open, and you see that structure right there? See that? That sits right on top of the larynx. So what is that? That's the epiglottis. So there's the epiglottis. Looks like a little curled tongue-like structure, but that's what it looks like. Okay. Now, on this guy, here's the larynx. Wilbur. I'm Wilbur. Here's the larynx, and you will notice right here, see all the C-shaped rings? So that would be the trachea. And then if you go underneath, right, that structure would be the esophagus. So there's the esophagus right there. But it always lies posterior to the trachea. Then along this, lateral to the trachea and the larynx, you've got this blood vessel. They're bilateral. These are the common carotids. And running right alongside the common carotid, a little white thread, which you can just make out right there. Can you all see it? That would be the vagus nerve. And remember, this is the only cranial nerve that goes below the neck and will innervate virtually every major organ within the ventral body cavity. And remember, vagus is part of the parasympathetic division, so under resting conditions, it oversees homeostasis in these organs. And sometimes you can actually see the vagus coming down and innervating the heart. I've actually seen little fibers. In fact, right there, you can see a fiber coming in. See that? So there's a nerve fiber obviously coming into the heart. Of course, in terms of the heart, right on the surface right here, see that? That tissue, superficial, that's the thymus. And this is where T lymphocytes mature. They go through a maturation process before they get released into the circulation. And then, of course, on either side, these are the atria, right? This is left atria, right atria. And then if I pull this away, even though you're not going to be able to probably see this very well, but what is that vessel right there? That's the, no, it's not the aorta, that's the pulmonary trunk. Yeah. And in fact, right here, here's the pulmonary trunk, and on this one, you can see the aorta. So this has been dissected just a little bit better in terms of being able to see the heart. And then right here, you see the brachiocephalic coming up, and then that branches into the common carotids that go up on either side. Then, if I turn this at the side, this is the thoracic region, and here is the aorta coming down through the thorax. So this would be considered the thoracic aorta. The other thing you should be able to see, and I don't, here it is the esophagus. So there's the esophagus right there. And then you see that vein that comes right up along the thoracic aorta? That's called the azygos vein. And then that little white thread, which I pointed out, I think, to some of you, that is the sympathetic chain ganglion. So that's part of the sympathetic division. You can also see little red and blue and white threads that seem to be going out between the ribs. These are intercostal arteries, intercostal veins, and intercostal nerves. However, I do not have those on the list, so I will not ask you those on the exam. You got that? But at least I'm trying to point them out to you. Questions about this? Let me go back to this. Okay, so with the heart, you also have, this would be where the anterior interventricular comes down. Now, it did not get injected, but this one did. So you can actually see right there the anterior interventricular coronary. If we look over here, you might be able to see there's the circumflex. See it right there? See that little red vessel? There's the circumflex branch of the left cornea that will go around to the back side of the heart. And then on this side, see it? There would be the posterior interventricular. Then here would be the anterior vena cava, and then right here, the posterior vena cava. Everybody see that? Then, you see that white thread? That white thread comes down, and you can see it kind of spreads out over the surface of this flat sheet of tissue. What is this flat sheet? That's the diaphragm, so that means that this has to be a nerve, and that is the phrenic nerve right there. Oops.
Sorry.
Oh, okay, so here's the phrenic nerve. Got it? And it comes right down along the vena cava. Of course, the two lungs, notice the shiny surface, that would be the visceral pleura. And then if you come over here, and sometimes I can get it and sometimes I can't, there it is. See that peel? I'm peeling it up off the surface. It's a real thin little membrane. That would be the parietal pleura that would line the inside of that cavity. The other thing that you may see, and it depends on the pig, you should be able to see lobules. You see that kind of fractured look on the surface? If you look closely, you can see it. Those are lobules. Like little, and they're not always hexagonal, but they're angular in shape. So you can actually see them. And then of course this would be the liver. Here would be the gallbladder right there. And of course if I peel it away, you can actually see right down at the base, that would be the cystic duct. You all see that? You know, that's really hard. So here, it's so short. But here would be the cystic duct. And then right here, you see where that ridge is coming out towards the duodenum or the duodenum, right here? That would be the common bile duct right there. So you can see cystic and you can see the common bile duct. In fact, there it is right there. Everybody got it? Okay, obviously this structure, this big sac, stomach, and then you see this, what looks like a little drape coming off the surface of the stomach. This is called the greater omentum, and that is also on that list, but it's like a drape of the peritoneum that drapes off. And then of course that helps to attach this structure, which is the spleen, which is elongated in pigs, but it's kind of a catcher's mitt shape in humans. And then of course right under the stomach, you see this rather diffuse organ right there, kind of a brown color.
Pancreas?
That would be the pancreas right there. You can see how kind of lumpy, but it's not a real defined organ. It's kind of spread out. Okay? And of course the head of it would be located to the duodenum right there. All of this, that would be the large intestine. And right here would be the first part of the large intestine, which would be the cecum. That's the cecum. And if that's the cecum, if you go back right here into the small intestine, what is that part of the small intestine that's coming into the cecum? You can see it right there. That would be the ileum, right? That would be the distal part of the small intestine. Now, if you take the small intestine, of which there's quite a bit of it, and you spread it out, you will see a membrane that is referred to as the mesentery. And it's really a layer of the peritoneum that comes up from the wall, wraps around, and goes back to the wall again. So it's a double layer of that peritoneum. But we refer to it as the mesentery. And in fact, you can see, well, not well, but there are blood vessels that are radiating out through that mesentery, supplying blood to the small intestine. Now that blood supply is coming from the superior mesenteric artery, okay, which is a branch off the abdominal aorta, right? Questions about all this? Okay, obviously kidney, and you can see the peritoneum here covering the kidney. I'll just peel that off a little bit. And then what is this structure coming out?
Ureter.
That would be the ureter. And if you follow it down, you notice how it enters this structure right here. So this is the urinary bladder. Got it? On either side of the urinary bladder, this one didn't get injected, but these are called umbilical arteries. And remember, this is a male, so right there is the vas deferens. Right here, coming off the abdominal aorta, which you can see that white structure. Everybody see that? This would be a testicular artery. And you can see how they converge. It converges with the vas deferens. Right there, if I stick the probe in there, that would be technically where the inguinal canal is. Right at the point where the testicular artery and the vas deferens are going to that one point. And then of course the testes, here's the testis, and then you see right along this lateral edge, this one for some reason doesn't look as good as some I've seen, but right there would be the epididymis. Okay? Is that all right? This one has a better one. So here you can see the testis and you can see the epididymis right here. Again, inguinal canal would be right there, and this would be the vas deferens. Although, boy, this looks pretty bad, doesn't it? Doesn't look very good. Over dissected. Been over dissected. The other thing that you can just barely make out is the vena cava. Here's the posterior vena cava. And you notice how they're running parallel, the abdominal aorta and the vena cava running parallel to each other. But when you get up here, right, when you get up here where the diaphragm is, notice how it's more centrally located, whereas the aorta is plastered right up against that posterior wall. So they kind of separate from each other as the blood goes back towards the atrium. Because remember, the heart is really what kind of centrally located. So the aorta has to come up to meet it. So, same in your bodies. Okay? Same in your bodies. Let me see if there's one other thing that I can find. Now here's, by the way, here's the common iliac right here. See that vessel right there? And one of these, if it comes down far enough, you should be able to see a branch, and one of these branches should be the internal iliac. The external will continue down in the leg, and somewhere in here should be the femoral. And I don't know whether any of these got dissected properly where you could see them. And it doesn't look like any of these. This one may be the best one right here. So here's the iliac, common iliac. And unfortunately, I think this could be the internal, although it doesn't show up very well. External would be right there, and it probably going down in the leg and becoming the femoral. Now, anybody have that list? I see somebody has a list over there. Was there anything that I did not see this? This would be the pyloric region. See that thickened area right there? That's the pylorus. Here's the body, and then up here at the top would be the fundus. Okay. Common bile duct. Now, hepatic bile duct is going to be hard to see, so you can scratch that off. I won't ask it. I've shown you the ileum. I've shown you the duodenum, the mesentery, the umbilical arteries, umbilical vein, which remember is right there, coming out of the liver. Hepatic portal vein always is very hard to see on this, and so I will not ask you the hepatic portal. I'd like to, but you just don't see it well. Anterior interventricular, posterior interventricular. Again, here's anterior, and then the posterior on this back side. Circumflex, I think I showed you on this one, the circumflex. The right coronary, that would be over here, and there you can see it, right there. See it? That's really a nice one. You can actually see the latex inside of it. Pulmonary trunk, obviously there. The thoracic aorta was right there.